Youth present here today. Boys and girls, you are Uganda's future. You are its future leaders and professionals. You are the mechanics, the nurses, the carpenters, the engineers, the teachers that Uganda needs to become stronger and more prosperous. This means that all of you need to grow up healthy, to become strong citizens and good parents. This also means we need to work together to reduce the number of girls who become mothers too soon. Ladies and gentlemen, let me start by recognizing the number one actor that can help us leading forward in terms of the quality of services we give to our young people. We have to acknowledge the government of Uganda, and we have to acknowledge the Ministry of Health. I congratulate you. Join me all in thanking the Ministry of Health for making it easier for mothers in Uganda to receive professional health care when their babies come into the world. Today, I am delighted to say, Honorable Minister, 6 out of every 10 women in Uganda, that is 58%, now give birth to their children at health centers with the support of professional health workers. Well done. This is an improvement from 2006, when only 42% of women delivered with support from skilled birth attendants. We have also noted that 30% more women are able to access family planning to enable them to space their births and have the number of children they can actually care for. The Ministry of Health has also worked very closely with the United Nations and other partners to reduce the number of HIV transmissions from mothers to their children. Between 2012 to 2015, the number of babies born with HIV has fallen from 30,000 to 9,600. This means more healthy babies. Congratulations, Uganda. We all love our mothers. We all love seeing them healthy and strong. If we want to see larger numbers of healthy women as part of Uganda's emerging strong human capital base, the work has to start during the period of adolescence. Adolescence is a very critical stage of life. It is a very challenging time for any person, as most of us can still remember, but it's also very important. We at the United Nations recognize it takes a village to raise a child, and we will continue to work with the parents, community leaders, development partners, and of course the government to invest in healthy growth of girls and boys. We believe that this will help girls prepare for their future roles as wives and mothers, but it will also help the boys to stay healthy and understand their future role as fathers and husbands. Let us take a few minutes to go over some of the challenges that we have heard today that can affect adolescents and have far-reaching implications. Thousands of girls are forced into child marriage, putting them at risk of unwanted pregnancies. According to the Uganda Demographic and Health Survey, 49% of girls are married before they turn 18. The consequence are the high rates of teenage pregnancies we've heard here today. It is important for all of us to remember, girls under the age of 20 face double the risk of dying during childbirth compared to women over 20. Today, unfortunately, 28% of maternal deaths are attributed to young girls between 15 and 24. If we do not address child marriages and teenage pregnancies together, we cannot hope for safe motherhood in Uganda. In some parts of this Ugandan society, young girls are subjected to female genital mutilation, a means of initiating them into womanhood. These women, these girls, experience challenges during childbirth, which sometimes lead to their death. In addition, young people, especially girls between 15 and 24, are also disproportionately affected by HIV, one of the causes of maternal mortality. Among adolescent girls, unfortunately, the prevalence stands at 9.1%, when national prevalence stands at 7.3. To make matters worse, too many young people still find it hard to get reproductive health and information and care. Even though I must say, Honorable Minister, I was really delighted to see how many services are being offered here today. And I can commit to you that as the United Nations, we will support them to make sure the voice is heard throughout the country. Ladies and gentlemen, investments in the health of adolescents, particularly in the adolescent girls, are among the most cost-effective development expenditures in terms of their returns for society. Dear parents, cultural and religious leaders here present, as we focus on opportunities to enhance health, water, electricity for sustainable development, we must invest in the health of our adolescents just as importantly. This is the only way for us to create a healthy workforce capable of leading Uganda's economic transformation. Today's adolescents are the future agronomists, future midwives, future teachers, carpenters, parliamentarians, ministers, and even artists. So what are we going to do to help make this situation better? Going forward, ladies and gentlemen, we at the United Nations have identified opportunities to increase our investment. Allow me to share a few. We will strengthen individual and community involvement in promoting safe motherhood by engaging in dialogues with cultural and religious leaders and communities to end the social and cultural norms that promote child marriage and teenage pregnancy. And here, Honorable Minister, once again, I am delighted to say that last week I was in Karamoja and we've already initiated these dialogues there. We must explain the impact of child marriages and other harmful practices to the quality of life of families so that they understand why this needs to change. We will help provide adolescents with information and services to enable them to protect themselves from teenage pregnancies. And Honorable Minister, here we need everybody's support to make sure that girls go to school, girls stay in school, and girls can return to school. When girls are educated, they have a better chance of having healthier children. They earn higher incomes and in a better position to get themselves and their families out of poverty. When girls have been pregnant, please let us work together to make sure they return to school. We will continue our work with you to empower more midwives with the skills and resources they need to provide critical health services to pregnant adolescents and to all women. I heard the local council, we will try to begin here. We will also work to increase the number of health service providers that offer sensitive, confidential services to the adolescents when they need it. This must include access to HIV testing. And once again, congratulations for having it going on as we sit here today. Last but not least, we will work to prevent violence against women, including women during pregnancy. The consequences of violence against women, they traumatize the mother, the children, the family, and the entire community. Ladies and gentlemen, as I conclude, Uganda's National Vision for 2040 recognizes the importance of developing its citizens so it can drive sustainable and inclusive economic development. This has to include investing in the adolescents. On behalf of the United Nations system in Uganda, which includes 18 agency funds and programs, I pledge our commitment to continue working with the government, the Office of the First Lady, to promote the health and well-being of adolescents, so that you, young people of Uganda, can become the productive citizens that Uganda needs to achieve its development aspirations and eventually end maternal mortality in this nation. I thank you.
Wherever you are. support. Thank you. Okay, thank you. A clap offering, yes. A round of applause. Thank you.
You can do extraordinary work. I really thank you. Just one appeal to you, remember ours is a calling to serve God, and we are serving out of love. Thank you, congratulations, and may God bless you.
Thank you, Honorable Minister. In the same spirit, Honorable